If you love your penis, this video is for you. I'm Dr. Luna, a urologist and pelvic surgeon, and today we're going to break down 10 things you should absolutely never do to your penis. As someone who treats men's health issues every single day, protecting penile health is a big part of my job, and it should be important to you too. In this video, I'm going to walk you through 10 crucial habits that most men never think about, but should. And make sure you stay with me until number 10. That one catches most guys off guard. Before we dive in, I need to ask you for a quick favor. If you've been following my videos or watching my content regularly, please take a second to subscribe. And if you're already subscribed, don't forget to click the notification bell. I upload a lot of educational content here, and it's easy to miss something important. Right now, only about 25% of people watching are actually subscribed. So do me a big favor, hit that subscribe button, and if possible, share this channel with someone who might benefit. It truly helps spread proper health information across the world. Number 1 is straightforward. Don't neglect your penis. Many men don't realize this, but the way your penis functions is one of the clearest indicators of your overall health. When researchers follow men who begin experiencing erectile problems, within 7 years of the onset of those issues, about 14% end up having a heart attack. There's a reason erectile dysfunction is often called the canary in the coal mine. I like to call it a vital sign, because strong desire and strong erections tell you that your body is working the way it should. It means your blood circulation is healthy, your hormone levels are balanced, your nervous system is functioning properly, your stress is manageable, and you're not putting harmful substances into your body that might be affecting performance. That leads us straight into number 2. Don't experiment on your penis with DIY methods. I've seen just about everything in my practice, and trust me, there is no homemade trick, cream, mixture, or miracle hack that will safely make your penis longer or thicker. Nothing you mix in your kitchen is going to magically enlarge it overnight, no matter what the online ads try to sell you. I remember coming across a post where someone claimed apple cider vinegar made their penis grow instantly. I sat there thinking, that doesn't even make biological sense. But I do understand why men fall for these things. When it comes to sexual health, a lot of men feel desperate for improvement, whether it's confidence about size, trouble with erections, or performance worries, and that desperation makes people vulnerable to untested, unsafe ideas that can actually cause damage. Let me give you a few examples. One common one is jelqing, using your hands to apply pressure and stretch the penis in hopes of gaining length. The problem? This method can create tiny internal tears, repeated micro-injuries, and long-term scarring. And yes, those injuries can turn into erectile dysfunction later on. Ask any urologist. We all have stories of young men who tried jelqing aggressively and ended up hurting themselves. Because let's be honest here, when you tell a guy something might help him, he doesn't do it lightly, he goes full force. And that all-in attitude often leads to permanent injury. So please, avoid it entirely. Another dangerous practice is men creating homemade constriction devices. If you've seen my video on constriction bands, you might remember the case where a man slipped a metal construction nut over his penis. By the time he reached the emergency room, we had to call the fire department to use a vibrating saw to remove it. I wish I were joking, but I'm not. He had passed out after putting it on, and when he woke up, his penis was so swollen there was no way to slide it off. Another man cut a ring out of a plastic soda bottle and it got stuck the same way. Guys, it's simply not worth it. If you truly need a constriction band, you can buy an actual medical grade one for around $20 online. They're designed to be safe, flexible, and removable. Not something that traps you in the ER. Number 3. Keep it clean. Most men know they should wash their penis, but the real issue happens when someone has a foreskin and doesn't consistently pull it back to clean underneath. If the area under the foreskin stays moist or unwashed, it can lead to irritation or infections like balanitis. And trust me, That can be extremely uncomfortable. Always take a moment to gently pull back the foreskin, rinse underneath, and dry it properly. And if you can't pull your foreskin back at all, that's not something to ignore. Penile cancer is extremely rare, but the cases that do happen often involve people who couldn't retract their foreskin, meaning they couldn't see or inspect the skin underneath. So I always tell patients, you should be able to retract it. If you can't, talk to your urologist. Sometimes the tightness can be treated with a topical cream, stretching devices, or, in rare cases, circumcision. But you absolutely need to be able to clean and inspect underneath. On the same topic, avoid overly harsh washing. A lot of guys use heavily scented soaps or scrub the area too aggressively, and that causes irritation. The skin of the penis is delicate. It isn't meant for rough exfoliation. Let warm, soapy water flow over it, remove any buildup, keep things clean, but don't scrub or rub hard. Too much friction can cause cuts or rawness. Number 4. Don't ignore pain or warning signs. If something feels wrong or looks off, speak to your doctor. Please don't brush it aside. Pain, burning, sores, discharge, or swelling can indicate a sexually transmitted infection, or sometimes a urinary tract infection. Seeing blood in your urine can be a sign of kidney stones, bladder stones, or more serious issues, even cancer in rare cases. If you notice an ulcer, a sore that won't heal, or anything that looks unusual, it could mean something is happening on the skin itself, including penile cancer. I know it's uncomfortable to show a doctor your genitals or to explain what happened, especially if you worry about being judged for unprotected sex or a risky encounter. But your health is more important than embarrassment, and if you ever feel judged, find another doctor. Your care should feel safe, not shameful. One of the saddest situations I've seen in my career were men who ignored ulcers or lesions on their penis out of fear, only to discover it was cancer. Penile cancer is extremely uncommon. I've only seen a handful of cases in my entire practice, but when it does occur, it can be very aggressive. Most men delay seeking help because they're terrified something will be done to their penis. But here's the truth. The earlier you address it, the less you'll need done. Waiting too long leads to far more drastic treatment. Number 5. Stay in control and stay safe. There is nothing more attractive or more freeing than practicing safe sex. When you're intimate with someone and you're not stressing about STDs or an unplanned pregnancy, you can let go fully. You can be present, uninhibited, relaxed, and open. That's what leads to truly great intimacy. So always put safety first. There are plenty of ways to practice safe sex, and there are countless types of condoms out there. Try different styles, ultra thin, textured, snug fit, whatever feels best for you. Involve your partner in choosing the right one, but no matter what, safety is the priority. Now let's talk about control. Why is staying in control important? Because accidents can cause serious injuries, including something most people think is a myth, a penile fracture. If you're having very intense sex and your erect penis bends sharply, maybe you slip out and hit your partner's pubic bone instead. That can tear the tissues inside the penis. And yes, that's a medical emergency. If it happens, you need to go straight to the ER because it usually requires surgery to repair the tear. What actually tears is the thick outer layer around the erectile chambers, called the tunica albuginea. If it isn't surgically repaired, about half of men who wait at home end up developing erectile dysfunction later. Getting it treated right away protects the ability to get strong erections in the future. And trust me, you'll know when it happens. Most men hear a sudden pop, feel immediate pain, and the penis swells quickly, often turning purple, like what we call an eggplant deformity. This is why maintaining control matters. Hold on to your partner's hips so you can guide the movement, the angle, and the pace. This reduces the chance of slipping out and bending the penis during vigorous thrusting. Another key factor is lubrication. Lube makes everything smoother and reduces friction, lowering the risk of injury. Plus, it makes sex more enjoyable, it's fun, it's slippery, and it enhances sensation for both partners. And remember, lack of natural lubrication isn't a sign that your partner isn't aroused. It's extremely common. As women approach perimenopause and menopause, natural moisture decreases. Younger women can also have less lubrication because of medications, hormones, birth control, or simply biology. It doesn't reflect their desire. Number 6, don't overheat it. So what do I mean by don't make it hot? I'm talking specifically about your testicles. They need to stay in a cooler environment. There's a biological reason why men's testicles hang outside the body while women's ovaries stay inside. Sperm production requires a very precise, slightly lower temperature. When your testicles are exposed to prolonged heat, especially moist heat, it can interfere with sperm production, potentially affecting fertility. In some cases, it may even influence testosterone levels. So try to avoid frequent or long sessions in places like hot tubs, steam rooms, and saunas. Use them sparingly. When you're working with a laptop, keep a barrier between the device and your groin so the heat doesn't radiate directly onto your testicles, and try carrying your phone in your back pocket instead of the front, since electronic devices generate heat that can impact testicular function over time. Number 7. Treat it gently. What do I mean by be nice to it? This is about masturbation habits. Try not to handle your penis too aggressively. Behaviors like the death grip, which I've talked about before, involve using extremely tight pressure when masturbating. The issue is that this kind of sensation can't be matched by a vagina, a mouth, or any other orifice during partnered sex. When someone relies on extremely intense, unnatural pressure, the body can get conditioned to only respond to that level of stimulation. Then you might find it harder to get aroused with a partner or maintain an erection, simply because the real-life experience feels totally different from what your brain is used to. So when I say be nice to it, I mean choose a style of self-stimulation that resembles the type of sensations you would feel with another person. Use lubrication, take your time, and focus on pleasure. Not rushing, not hiding, not treating it like something shameful or mechanical. Number 8. Don't smoke and take care of your overall health. Gentlemen, smoking is a guaranteed way to harm your erections. It doesn't just increase risk slightly, it can directly cause erectile dysfunction. So, don't smoke. Beyond erections, smoking is also a major risk factor for bladder cancer. I see it often in my practice. Bladder cancer can be severe, requiring complicated surgeries that dramatically affect quality of life. Lifestyle choices matter immensely for penile health. This isn't glamorous, fast, or easy, but it's crucial. Remember what I mentioned in number 1? Men with erectile dysfunction have a higher risk of heart attack, about 14% within 7 years. That's because erections are a marker of blood flow and overall cardiovascular and hormonal health. Taking care of your body directly protects your sexual health. So what does that mean practically? Eat a balanced, nutritious diet. Avoid smoking and limit recreational drugs. Minimize alcohol. Exercise regularly, both aerobic and resistance training. Aerobic exercise improves blood flow, while resistance training supports healthy testosterone levels. Both are essential. Start small if you're overwhelmed. Pick one tiny habit that's impossible to ignore and stick with it. I recommend checking out the book Atomic Habits, which gives practical steps for building lasting, positive routines. You can apply these principles to your health, fitness, and sexual well-being. Finally, manage stress. A little stress is normal, even necessary, but chronic stress is damaging. Long-term stress takes a toll on your body, your sex drive, and your ability to maintain strong erections. If you find stress is a constant in your life, take action. Explore ways to reduce it and focus on what's within your control to improve your daily quality of life. Number 9. Be kind to yourself. I often see men put tremendous pressure on themselves when it comes to their penis. They stress about performance, worry about appearance, or get anxious about intimacy with their partner. That stress doesn't just sit there. It actually makes things worse. Here's the cycle. If you have a problem in the bedroom, say you can't get an erection once, the next time you try, your mind fixates on that failure. That anxiety alone can make it even harder to perform. Then the frustration grows, the stress amplifies, and it turns into a vicious loop that feels impossible to break. So the most important thing? Be gentle with yourself. Everyone experiences fluctuations in sexual function. Sometimes your penis just won't respond, and that's completely normal. One off night doesn't define your sexuality or your life. It will come back, and stressing won't help. Too often, men keep this anxiety to themselves. They don't talk about it, don't share their worries, and that isolation only makes the stress worse. Give yourself permission to relax and understand that occasional setbacks are a normal part of life. Number 10. Use it or lose it. Is there truth to the saying, use it or lose it? The answer is yes to some extent. Sometimes men stop having sex or sexual activity because they're struggling with erections. They feel embarrassed, stressed, or maybe their partner isn't interested. The problem is, if you're not having erections at all, including nighttime erections, your penis can start to experience changes. Normally, men have 3 to 5 erections during the night. These nocturnal erections are the body's way of keeping the penis healthy, maintaining proper blood flow and oxygenation. When they stop, you might notice subtle changes, a slight shortening, firmness changes, or even scar tissue forming in the tissue. Over time, this can contribute to actual shrinkage if the erections don't occur. Low sex drive can also become an issue, often linked to stress, hormonal changes, or other health factors. If you avoid sexual activity for an extended period, your body may adjust by lowering its natural drive. While that may not be a concern for some, it can create problems in a relationship if your partner wants intimacy. Sex and intimacy have countless physical and emotional benefits at any age. Making the effort to stay sexually active, even occasionally, helps maintain health, connection, and well-being. Not everyone wants sex all the time, but the value of intimacy is undeniable. If you missed my video on how sex can actually improve your health and longevity, be sure to check that out. And as always, take care of yourself, because your health, your intimacy, and your happiness are worth it.